Dr. Alexandra Talay. This is my patient, Hannah Jacluseau. And today we're going to be doing some tests on the lumbar spine and lower extremities. So first, we're going to stand up and, please sit down, patient. From that position, can you please stand?
Yes.
Great. So if a positive would be if they went from a seated to a standing position, but I saw that they were having trouble standing, this would be a positive, indicating sciatica or lumbosacral or sacroiliac pathologies or joint lesion. Cool. So now we're going to do belt test. I'm going to have you turn that way, and I'm going to be just supporting you on your hips. So can you reach down and touch your toes? Good. And come back up for me. Any pain with that?
Nope.
Okay. So now I'm going to be holding you right on the front of your hip bones, like this, and I'm going to be right on the back of you. I want you to bend down a little bit. Yep. Keep bending. Good. You're good. You can come back up. So for our positives, if she felt pain on both of those movements, that would mean a lumbar pathology. But if she just felt pain on the first movement, yes, then that would just be a sacral issue. Cool. Heel walk. So for heel walk, what we're going to do is, can you stand right over there? And yeah, anywhere is great. But I just want you to take a couple steps this way, but walking on your heels. Yep, awesome. Cool. So for here, if she was inability to perform this test would indicate an L5 disc lesion. So now do the same thing, but walk on your toes this next time. Awesome. For this, inability to perform this test would indicate a S1 joint lesion. L5S1. For Kemp test, so I'm going to have you face that way. Seated, my bad. So, oh, just kidding, that's not this test, that's a different one. So you're going to lay down on your back for me. I was right the entire time. Please sit up, do exactly what you were doing before. I promise I'm not an idiot. Okay, so I'm going to stabilize. I'm going to have you cross your arms in front of you. Yep, perfect. I'm going to stabilize on our opposite PSIS. I'm going to have you bring this shoulder, crunch like that, perfect. And now I'm going to reach around you, and I'm going to bring you back, kind of at an oblique angle. Okay, any pain with that?
Nope.
Okay, I'm going to do the same thing here. We're going to bend to this side. I'm sorry, I grabbed your hair. And we're going to rotate and come back. Good. You can come back forward. Any pain with that?
Nope.
Good. So, if she felt localized pain, this would indicate a myospasm in the lumbar spine or facet capsulitis. But if she felt radiating pain, radicular pain, or recreating the sciatic problem, sciatic pain that she was originally feeling, then that would be a disc protrusion. If that pain was felt on the side that we lean towards, that would be a lateral disc bulge. But if the pain occurred when she leaned away, this would be a medial disc bulge.
Sounds about right.
Yeah, sounds about right. Lay on your back for me. So what I'm going to do here is I'm just going to take your leg and I'm going to bring it from up to about 70 to 90 degrees. Any pain with this? Or I would bring it to the point of pain, or 70, 90 degrees. So she doesn't have any pain, but let's say she did have pain. If she felt pain anywhere from 35 to 70 degrees, then that could possibly be sciatic radiculopathy. But if that pain was after 70 degrees, then that's typically tight hamstrings. Braggart sign. So, I would be doing the similar thing. I would bring her leg up, and I would get to that point of pain. I would ask her, are you in pain? Nope. If she said that she was, I would lower about 5 to 10 degrees. Now she's out of pain. At this point, I would forcefully dorsiflex the foot, and if that reproduction of pain occurred, radiating or dull posterior thigh pain, it would indicate sciatic radiculopathy. Sicard sign. So, here, once again, I'm going to do a straight leg raise. I would get to that point of pain. Are you in pain right here? If they said yes, I would then lower 5 to 10 degrees. Now, I would forcefully dorsiflex the big toe. If that reproduced the radiating or dull posterior thigh pain, that would also indicate sciatic radiculopathy. Lindner. So here, can you take your hands, spread apart your breast tissue for me? Like this? Like pull your There you go, perfect. I'm going to place my hand in between, press down, and I'm going to take your head. I'm going to bring your, no, let me do it. The patient's in pain. I'm going to bring your head and bring your, well, you're sitting on your hair technically, but if you weren't, bring your chin to my fingers. Good. If this movement in her neck caused her to feel posterior thigh pain, then that would also indicate sciatic radiculopathy.
Hi.
So, Turin sign. This one is the most important, or one of the most important ones, because I won't even be bringing up the leg. I'm just going to be dorsiflexing the big toe while she's laying completely supine. So, I would dorsiflex the big toe. If she felt radiating or dull posterior thigh pain, this would indicate sciatic radiculopathy.
Girls,
Yes?
I hate to bother you, but if you want to go get cream,
I'm not sure the grocery store is open.
Okay.
maybe the gas station.
Gas station.
Excuse
will be open. Maybe you can
my
find
family.
something there, honey.
Okay.
Sorry to bother you.
No worries. Let me just finish up this video and I will go get it right after.
All right.
So for bonnet sign, what I'm going to be doing is I'm going to be It's all good. My professors are chill. I will be stabilizing. Okay. I'm just going to stabilize on her ASIS. I'm going to medially rotate the leg, bring it into adduction, and then we're going to do a straight leg raise towards that opposite shoulder. Once again, if they felt radiating or dull posterior thigh pain, that would indicate sciatic radiculopathy. But the important thing here is that pain would be immediate, because the second that I bring that leg into medial rotation and start to adduct, their piriformis would stretch. So the immediate pain from sciatic radiculopathy would be because of piriformis syndrome. Good. I don't know where that, oh, there we go. Well, leg raising test. So, she comes in. Her pain is on this side, is on the left side. So, I'm going to go to the unaffected leg. I'm going to do a straight leg raise on that unaffected leg to about 70 degrees. And I would ask her, are you feeling pain on that affected side? If she said that yes, she was feeling pain on that affected side, then I would say that indicates a medial disc protrusion. If she felt the pain decrease on that affected side, then we know that it's a lateral disc protrusion. And femoral stretch test. So for here, okay, so this is how I'm going to have you lay. I want you to lay on your side, and I want you to flex your neck and bend your knees like this. But your neck is going to be to your chest. Good. I'm going to have this stretch out a little bit more. Go. Actually, can you do that but face there? Because I need to bring your leg back. My bad. Good. Bring your neck to your chest. Perfect. So for here, I'm just going to be taking her leg, and her neck is in a flex position. I'm going to bring the leg back. Positive would be if she felt pain in the anterior thigh compartment, that would indicate femoral nerve, tractioning of the femoral nerve at L2, 3, and 4. Yeah, those nerve roots. To now foot sign. You can sit up for me, or just lay on your back. That'd be great. So here, this is my my reflex hammer. Okay, it feels like this. I'm just going to be doing that over your ankle. So I'm going to go to the medial malleolus and go behind it, and I'm going to do that same thing. If you can kind of see it. I'm doing it, I promise. So I would tap behind the medial malleolus. If she felt pain or paresthesia to the forefoot, that would indicate tarsal tunnel syndrome. And Morton test. So I'm going to have you, can you actually switch so they can see? Yes, perfect. So for here, I'm just going to be going over the forefoot, and I'm going to be providing lateral pressure on each side of the foot. So I'd be pressing in, and if she felt pain in between, if she felt pain in the forefoot, that would indicate metatarsalgia or neuroma. That pain would typically be between the 3rd and the 4th metatarsal. So that should be it. Toodaloo!